Let me take you back 14 years when I was told you have cancer. I knocked on the doors of leading research institutions to learn their views and positions with regards to different ways to treat cancer. Two leading institutions were the Queen Wilhelmina Fund, KWF, here in the Netherlands, and the World Cancer Research Fund, WCRF. They had performed years of research into cancer prevention, and they shared the same standpoint. Eating the right foods reduces your chance of getting cancer. Eat the wrong foods and you increase your chance of getting cancer. Okay. That made sense to me. So I set out to discover what are the right foods, and what are the wrong foods. It was clear that the wrong foods could be a root cause of my cancer. I now know that this may not be true for all cancers, but certainly for many of today's cancers. And plenty of research had been performed on the role of nutrition in the post-treatment phase. They talked about eating the right foods to improve health, to improve quality of life, and to reduce the risk of cancer returning. Once again confirming that the wrong foods might well be a root cause of my cancer. This also made good sense to me, so I was even more determined to discover which foods to include in my diet, and which foods to avoid. And this is where I stepped a little bit ahead of myself. I could not find any research studies on nutrition during cancer treatment, but made some logical assumptions, or so they seemed at the time. Removing the wrong foods could affect my cancer by slowing down the growth. And including the right foods might even help reverse the cancer growth. Imagine my cancer disappearing through something as simple as a change in diet? And what was the worst thing that could happen? That I only improved my health? So what did I really have to lose? In my thinking I had everything to gain, and little to nothing to lose. It was a stab in the dark, but I came across the Moerman diet, a cancer diet developed by a Dutch country doctor, Dr. Cornelis Moerman, almost 100 years ago. I wanted to try it for a couple of months and experience what might happen. This meant that I wanted to delay the planned cancer treatment including chemotherapy for a couple of months. And this is when I hit a brick wall heads on. My oncologist who refused to support me if I chose this path, and the cancer institutions who did not share my thinking. They ridiculed my thinking, both to my face, and with the standpoints they expressed on their websites. These standpoints, call them position statements, have not changed these past 14 years, and can still be found on their websites. Diet cannot be used as a treatment for cancer. Diet alone cannot cure cancer. Diet cannot replace chemotherapy nor radiation therapy as a cancer treatment. Diet cannot influence an ongoing cancer process. There is no evidence to show that diet can affect cancer in any way. These are the position statements that dominate the world of cancer treatments and cancer therapies. They appear on the websites of leading cancer research funds and cancer institutions across the globe. With one notable exception. One institute that appears to think differently. The National Cancer Institute, NCI, of the USA. And here is a shocker. It turns out that none of the position statements are true. I did not know this as a first-time cancer patient 14 years ago when I was informed you have cancer. But I do now. Can you imagine how difficult it was to opt for a change in diet 14 years ago, when everyone around me was telling me that my choice was ridiculous? Telling me to listen to the experts, who had years of research and training and experience behind them. Instead, I chose to listen to myself. My life, my body, my choice. And it turned out to be a lucky choice. The time has come to introduce some truths, whole truths and nothing but the truth. The Dutch Queen Wilhelmina Fund, KWF, and the World Cancer Research Fund, WCRF, are both very outspoken on this subject, even though in their 75 years and 30 years of existence, respectively, they have never funded any research projects investigating the potential role for diet and nutrition during cancer treatment. Zero funding. Zero research. For many years I have wondered why they position themselves as leading authorities on this subject, and whether there was any real evidence to support their adopted position statements. After all, if there is no research taking place, how can there be any evidence? Have they just been pushing a convenient opinion, wrapping it up as a truth? When I was told you have cancer back in 2010, some 14 years ago, there was some partial truth to the statement there is no evidence that diet can influence an ongoing cancer process, let alone cure cancer. The whole truth was that there was also no evidence to the contrary, because there was simply zero research to base it on. Plenty of research money was going into the study of nutrition and cancer prevention, and post-treatment survival, but no research into the potential role for diet and nutrition during cancer treatment. So the position statements appear to be nothing more than opinions. And these opinions are unfortunately wrong. As the real world continues to evolve, the emerging medical research is providing new real-world evidence that there is a key role to be played by diet and nutrition during cancer treatment. Not only is the cancer patient healthier and more able to endure the cancer treatment, but the cancer treatment outcome is also improved. Diet most definitely can affect cancer and influence an ongoing cancer process. But I already discovered this for myself back in 2010, when I decided to delay cancer treatment for 3 months, in favor of changes to my diet and lifestyle. In 14 years there has never been the need to resort to a conventional cancer treatment such as chemotherapy. And now I am happy to share some of the new insights and research results that have emerged in the past 10 years, showing that diet most definitely can influence an ongoing cancer process, and in so doing also improve cancer treatment outcomes. Diet and nutrition are now being recognized as key players in successful cancer treatment outcomes. Evolving ideas include the atavistic model, thanks to an initiative and funding from the National Cancer Institute. Challenging the best minds from different scientific disciplines, including medicine and oncology, to take a fresh look at cancer and come up with new models, new ways of thinking about cancer and cancer treatments. And the atavistic model just happens to be a model that points towards immunotherapy and diet therapy as promising routes to be pursued in the treatment of cancer. And this has led to measurable progress in immunotherapy and research into how diet and nutrition can improve cancer treatment outcomes. Some references to recent research studies, including clinical trials. The effect of diet and nutrition on T-cell function in cancer. Dietary interventions and precision nutrition in cancer therapy. Ketogenic diet in cancer management. Developing dietary interventions as therapy for cancer. Ketogenic diet in cancer. Fad or fabulous? Cancer, microbiome and cancer immunotherapy. A comprehensive review. Evidence that dietary modulation of the microbiotica can have synergistic effects during cancer therapy. Impact of different types of diet on gut microbiotica profiles in cancer prevention and treatment. Diet and chemotherapy. The effects of fasting and ketogenic diet on cancer treatment. Ketogenic diet in the treatment of cancer. Where do we stand? The majority of preclinical and several clinical studies argue for the use of the ketogenic diet with standard therapies. Current research is no longer occupied with whether diet and nutrition can or cannot influence an ongoing cancer process. It is no longer concerned with the question of whether diet and nutrition can improve cancer treatment outcomes. The answer to all those questions is a resounding yes. With the new insights provided by immunotherapy and atavistic models and related research these past 10 years, research scientists are moving ahead with a new generation of questions. Current research is increasingly focused on precision nutrition, discovering the best ways to design and implement nutritional interventions, nutritional therapies. The best ways of integrating diet and nutrition into cancer treatments, to improve cancer treatment outcomes. And who knows, maybe coming up with diets that can be used to treat cancer on their own. Such as the Moorman diet, which has been successfully used by exceptional cancer patients for almost 100 years. Cornelis Moorman developed his nutritional guidelines in the 1930s. Compared to the knowledge of the 21st century, hardly anything was known in the field of nutrition and nutrients in his time. And there is no supporting evidence to date other than a sizable collection of personal anecdotes that continues to grow each month. No evidence, because there has been no research. And not for want of trying. In the early 1980s, a research proposal put together at Dutch government level, and designated high priority, was rejected by the funding institution. The Queen Wilhelmina Fund, KWF, refused to cover the costs of the research. But that is a story in its own right. And maybe we should let bygones be bygones, and simply move forward. Back in 2014 I also remember experimenting with liposomal vitamin C, and being laughed at when I suggested that high dosages of intravenous vitamin C might be effective in treating cancer. That idea was even more far-fetched than my diet therapy. The idea was born from the knowledge that vitamin C and glucose use the same receptors to access cells, and that if an overdose of glucose, as in the case of high blood sugar levels, can block vitamin C, the reverse can also be true. High-dosage vitamin C intravenously injected into the bloodstream, in combination with lower blood sugar levels achieved through fasting or a keto diet. Simplistic thinking from a layman, a cancer parent. However, the last 10 years have borne witness to a complete turnaround. In fact, recent studies and publications are actually verifying a promising role for intravenous vitamin C specifically in high dosages. And that is also a story in its own right. And once again, some references to recent research studies.
High-dose intravenous vitamin C, a promising multi-targeting agent in the treatment of cancer.
Role of vitamin C in targeting cancer stem cells and cellular plasticity. The potential role of vitamin C in empowering cancer immunotherapy. Vitamin C, from supplement to treatment. A re-emerging adjunct for cancer immunotherapy. The times, they definitely are a-changing. Better late than never, is what I say. About bloody time too, is what I am really thinking. We are still scratching the surface when it comes to designing and developing diet and nutrition therapies to treat cancer, but we can now comfortably make the following statements based on real evidence. Diet can play a key role in treatments for cancer. Diet alone may be able to cure cancer. Diet can influence an ongoing cancer process. Diet can affect cancer in many ways. Thanks for watching and listening. I hope you enjoyed this video enough for a thumbs up.